Unfortunately, it's all too common that a clinical trial protocol is developed and is fairly far along before patient-reported outcomes start to be considered. I think there are a number of reasons for this. I think first, the clinical development teams may be focused on other areas and may not think of the patient-reported outcomes immediately. And the second is that there may be a lack of expertise around patient-reported outcomes on the primary clinical development team. And I would say the times are changing and that it is almost necessary now in a development program to start thinking about patient-reported outcomes early. And this is because it does require some planning and expertise to integrate these kinds of outcomes and the technology to collect these outcomes into a program. Moreover, I think that a program benefits greatly from collecting this information earlier so that you can start to truly understand the patient experience very early so that later on you can be more systematic about how you collect information. For example, early on in a drug development program, one can have interviews with patients or have a very broad questionnaire with many different items in order to figure out what is that initial potential signal. Once you characterize that, you can create a more targeted questionnaire to use in your later development. But what do you do if you don't have that expertise in-house? Well, the first is that for larger companies, often that expertise does exist, but it might be in a group that's more focused on phase 4, on comparative effectiveness research, or on health outcomes. So one might bring a member of that team in earlier in a drug development program. The second is to contract out to a third party with expertise, and there are multiple consulting firms that have expertise around the development of patient-reported endpoints in clinical trials in oncology.